I'm Dr. Hina, working as a Reconstructive Urology Fellow in UK, and the topic of my today's presentation is women preference for cosmesis of incision used for open versus robotic lower urinary tract reconstructive surgery. Robotic-assisted laparoscopic surgery has dramatically altered the landscape of urological surgery. Robotic-assisted laparoscopic prostatectomy has become a mainstream procedure with proven benefit of reduced post-operative pain and reduced blood loss, quicker recovery compared to an open approach. Objective of our survey was to compare the cosmetic appeal of incisions used for open versus robotic-assisted laparoscopic lower urinary tract reconstructive surgery in women. Our survey was a comparative cross-sectional survey, and it included 100 female who presented in Urology Clinic of Western General Hospital, Edinburgh, Scotland. We included a female patient with age range from 19 to 84 years in our study, and BMI range was from 15.6 to 55 kilogram per meter square. And the patient who refused informed consent to be willing to participate in the study were excluded. Data collection tool that were used in our study was visual analog scale and preference of incision as shown on next slide. Preference of incision included Pfannenstiel incision, vertical midline laparotomy incision, robotic-assisted laparoscopic incision variation 1, and robotic-assisted laparoscopic incision variation 2. This is the flow chart showing methodology of our survey. In terms of result, among 100 patients, the mean age of our patient were 53 years and the BMI was 28.18. In regard to occupation of the patient, 24% patients were housewife, 45% were working women, whereas 31% were retired. In terms of first preference of incision, 78% of women preferred choice was incision A, that was Pfannenstiel. 3% preferred B incision, that was lower midline laparotomy incision. 16% and 3% patient preferred incision C and D respectively, that were robotic-assisted laparoscopic incision variation 1 and 2. In terms of second preference of incision, 3% patient preferred incision A, that is Pfannenstiel. 19% preferred B incision, that was lower midline laparotomy incision, and 56 and 22% patient preferred incision C and D respectively, and that were robotic-assisted laparoscopic incision variation 1 and 2. When we compared our data in terms of preference of incision with respect to previous surgeries, it showed that there is no significant difference in terms of first preferred incision with respect to previous surgery. However, there was significant difference in second preferred incision and with history of previous surgeries. We have also compared a relationship between first preferred incision and second preferred incision with respect to age, and it showed that there is no significant difference with respect to age. Overall, open incision were preferred over robotic incision in our survey by patients, and patient perception of the visibility of abdominal incision and previous experiences in terms of surgical scars may be the distinguished issue to explain the difference in the preference between open versus robotic-assisted laparoscopic incisions in based on our survey, we recommend that to have a study on a larger scale, as there are not enough studies available on robotic-assisted laparoscopic surgery role in female reconstructive surgery. Thank you.